China restricts travel and cancels major Lunar New Year events as part of the fight to contain the new coronavirus. Hello, I'm Anand Naidu, and this is The Heat. The World Health Organization decided that the viral illness that started in China is not yet a global health emergency.
I'm not declaring a public health emergency of international concern today. Make no mistake, this is, though, an emergency in China. But it has not yet become a global health emergency. It may yet become one.
The Chinese government is taking no chances in dealing with the spread of the virus. The Lunar New Year is one of the biggest holidays in China and considered the largest annual human migration in the world. But this year, many trips are being grounded. And what is this new coronavirus? CGTN's Nathan King explains.
Coronaviruses are so named because they look like a halo or crown under a microscope. First discovered in the 1930s, they infect the respiratory tract of mammals, including humans. Middle East respiratory syndrome, MERS, and severe acute respiratory syndrome, SARS, are also coronaviruses. Some also affect the gut and digestive system. The latest strain, first detected in Wuhan, is thought to be a new one. A common but not unique factor in these viruses is animal-to-human transmission. Scientists are currently looking at whether the Wuhan strain was first spread by wild animals, perhaps bats.
At present, the situation of disease prevention and control in Hubei is still very serious. The number of confirmed cases in Wuhan is growing fast.
Coronaviruses are difficult to replicate in the laboratory, which makes it harder to find cures or vaccines. Like most viruses, they can mutate quickly. That makes them easier to catch and easier to spread. One of the reasons you can catch a cold over and over again. Coronaviruses also spread quicker in winter months and disproportionately affect vulnerable populations with lowered immunity, like the very young and the very old.
First, these patients are generally older. 70% of them are over 60 years old. Second, these patients have varying degrees of pre-existing conditions.
Mortality rates vary, and fears over the spread of these viruses have created panics and sensationalist media speculation. As with all disease outbreaks, confirmed cases need to be isolated. People should take precautions like frequent hand washing and avoiding human-to-human contact with those in a high-risk area. China's National Health Commission, the World Health Organization, the US Center for Disease Control, and many other national health agencies are also taking precautions, sharing information, and urging best practices. Dealing with these viruses takes a mixture of vigilance and time for them to run their course, and lessons learned from previous outbreaks, like the SARS virus, means that Chinese and global authorities have a much better handle on how to contain and control this one. However, all viruses are different, and of course none knows international boundaries. Nathan King, CGTN, Washington.
There's much to discuss. Let's get to our panel here in our studio. Eric Deng is an epidemiologist at the Harvard Chen School of Public Health. Also with us, Kathryn Jacobsen is an associate professor of epidemiology at George Mason University. Joining us from New Haven in Connecticut, Chen is an assistant professor of public health at Yale University. And Victor Gao joins us from Beijing. He is a current affairs commentator and expert in international relations. Welcome to all of you. Dr. Chen, let me start with you in New Haven, Connecticut. The Chinese authorities, of course, are making vigorous efforts to contain the spread of this virus, as well as treat those who have already been infected. What is your assessment of the situation, and what more can be done at this stage?
I think at the first stage, very initial stage, China acted very swiftly by sharing the sequence of the genes of the virus with the global community, which was very fast and timely. And that facilitated the invention of the vaccine. So that will quickly accelerate that. And after that, China announced that this virus, this pneumonia, will become a grade A infectious disease. That means they will implement mandatory quarantine and also medical observation of suspected patients, but mandatory quarantine of confirmed cases. So that also help the prevention and the control of the disease. And further, China wanted to encourage people to come out to get treated. So they implement a more favorable health insurance policy by covering all the cost of treatment and the diagnosis.
Dr. Shi, you mentioned that China has shared the sequence of the gene of this virus. How does that help?
That will help the pharmaceutical companies to advance their stage of developing vaccines. This is very important. Just a couple of hours ago, I heard there are several pharmaceutical companies already respond to the call by going to inventing the drugs. They are going to the phase 1 of the clinical trial. And also there's an international coalition also responded by willing to fund such kind of initiative. So that is much, much quicker compared to the 2003 SARS period.
Eric, this outbreak comes at one of the busiest travel times in China. It's, of course, the Lunar New Year. There will be literally millions of people crisscrossing the country. Officials have already imposed a travel ban on several cities near Wuhan. What are the risks that this virus poses right now?
Well, the virus internally in China, obviously, within those cities, it's just an incubation pool. And at least stopping the outflow is good in terms of stopping the further outflow. But the virus has already escaped into Shanghai, Hong Kong, neighboring countries, and the case in the United States, in Washington State, that person actually flew from Wuhan and arrived in the US before any of this quarantine was in place. So I think it's one of those situations. It's very difficult to assess because it's still early. Like the Imperial College London's estimate doubled what the previous estimate was just a few days ago, yesterday. And this virus is also very tricky because it's coming in the middle of cold and flu season. Right. You don't know what you have is the cold, flu, or this coronavirus. And furthermore, this virus is purportedly infectious even when people don't have any symptoms, which makes it even doubly dangerous when it comes to spreading, controlling, identifying those who are infected.
So the priority is to contain it first and then treat people, or they?
Yeah. So I think containment. Right now, we also heard the other expert talk about the vaccine, but the vaccine is months, if not over a year away. Like, we don't even know if the vaccine. We've been trying to isolate a universal flu vaccine for many years, and we still do not have a stable flu vaccine. We're not sure if a vaccine can be generated or if this vaccine will mutate too quickly. So right now it's all about containment and control.
Kathryn, the Emergency Committee of the World Health Organization, they've been meeting, but they, as we heard in that report, they've stopped short of calling this a public emergency of international concern. What does that mean, and what would they be discussing right now?
So a public health emergency of international concern is a legal thing that can be declared under international health law. The World Health Organization has international health regulations that all member nations have signed on to. When they make that declaration, it releases certain resources to affected countries. It also puts into place some things like travel restrictions between countries that can be dictated by the World Health Organization. When something's declared to be a public health emergency, that is a resource designation more than it defines how serious or how concerning something is. That this was not declared a public health emergency of international concern doesn't mean the global community isn't worried, isn't trying to partner with China in ways to make sure that this gets contained quickly. And it doesn't mean that that designation won't change in the future.
What needs to happen for that to change?
There's a deliberative body at WHO that will be tracking the number of cases and tracking the spread and talking with government officials to try to figure out what measures need to be taken and what resources need to be deployed globally. For right now, China is being very aggressive about taking control measures, and mostly this is contained within China. There are very few cases that have been acquired outside of China. The case, for example, in Seattle was a traveler from China. So for right now, this is a relatively contained situation. So WHO will monitor it, but that doesn't mean that it's not a global concern right now.
Right. Okay. Victor Gao, talking about the spread of the virus, the chief executive of Hong Kong, Carrie Lam, she was in Davos at the World Economic Forum meetings. She talked about how the territory is preparing to deal with this outbreak. Let's listen to part of what she had to say.
I want to assure you that we have a system, we have a protocol, we have the resources, we have the isolation facilities in our public hospitals, as well as in some of the makeshift isolation facilities, making use of holiday camps, if quarantine is needed for some of those in close contact with this particular passenger through our very effective contact tracing.
Carrie Lam there, Victor. So can you tell us about the readiness of Chinese cities to deal with this?
Well, I think what Carrie Lam said at Davos is a vote of confidence, is a strong message of confidence, partially because back in 2002 and 2003, Hong Kong and Beijing were very much affected by the SARS outbreak. And as a result, both Hong Kong and Beijing have built up institutional build-ups and resources, capacities to deal with a major public health outbreak like this. And I hope people in Hong Kong well in dealing with this emergency. On the other hand, Wuhan was very much spared in the 2002-2003 SARS outbreak, and unfortunately, as a result, the city was not as much well prepared as Beijing or Hong Kong, which suffered in 2002 and 2003 outbreak. So right now, I think Wuhan faced a very major crisis, but all the other cities in China are also taking precautionary measures to deal with this outbreak. And I hope other cities in the world will also learn very quickly on a real-time basis what's happening in Wuhan and surrounding cities and take all the necessary precautions possible to prevent this from becoming a larger scale international crisis.
Dr. Chen, I'm going to get back to something we were talking about earlier, and that is this being declared a grade A infectious disease. What kind of obligations does that place on the authorities and, of course, on the people infected as well, insofar as their ability to travel and move around?
So this is a major measure because think about this 11 million population city, and now it's even more than one city being cutting the travel. So this means that the government really needs to effectively enforce the banning of the travel and make the prevention and control at a very high priority. And also we know that since this is a very large population, so it's really hard to make sure that everyone with suspected cases can be treated. This is a big challenge for Wuhan, not only at the hospital level, but also primary care system. In the last 10 years, China made a major achievement in building the health system by investing more in hospitals. But with the building of hospitals, that make the strengthening of the primary care system more difficult. But this time, this Wuhan coronavirus is really challenging the primary care. So if all the patients can be treated or can be diagnosed at a local level, they will significantly reduce their chance of cross-infection if they all go to the hospitals.
Right, and as I mentioned, this outbreak comes during the busiest travel period on the Chinese calendar, the Lunar New Year. Authorities have cancelled some celebrations in Beijing as they try to bring the spread of the virus under control. CGTN reporter Sun Tianyuan has more on those cancellations and how the public is responding.
The cancellations are a disappointment, but authorities say safety comes first. It's something that has to be done for a safer Spring Festival this year. And Chinese film producers also announced they would cancel scheduled screenings of their movies during this Spring Festival. Now, this is one of the most lucrative seasons. Last year, blockbusters for this particular period scored 11 billion yuan, or about $1.5 billion. But considering the risk of disease spread, the distributors say they will choose a later date to release the films. And also, the Palace Museum and the National Library in Beijing both announced to shut down temporarily due to the latest situation. Well, the Spring Festival travel rush is the biggest annual human migration on Earth, and hundreds of millions of people are traveling via planes, trains, and buses during China's favorite traditional holiday. The virus can be passed from people to people, so that's something you can't avoid in a travel rush like this. For travel safety, health experts suggest people wear masks or wash hands to reduce the possibility of transmission. As far as I know, beside the 4 Hubei cities with temporary travel restrictions, people can still travel elsewhere as they planned. In case they change their mind, they may also cancel their train tickets without any service charge. The fee is usually between 5% to 20% of the ticket. This came after China Railway Corporation's decision to drop the fee for passengers who plan to travel in or out of Wuhan, and later the group extended this to any domestic trip. The nation's Civil Aviation Administration followed and promised to cancel the service fee for travelers nationwide. People in the capital are cautious about the outbreak too. From my observation, just a few days ago, not many wore masks in public, but yesterday I saw almost 80% of them wore masks in the subway. And this evening I took a cab to the office. I noticed the driver was wearing a mask too. And it was freezing in the car because he rolled down all 4 windows a little bit to keep the air circulating. Face masks, including the surgical ones and the N95, have been sold out, triggering tight supplies in many regions, including Beijing. And so people are definitely more alerted by the situation now.
So you got to ride around in a cold cab as well in Beijing. Eric, how contagious is this virus? I mean, is there a way that these things are categorized? Because as we heard our reporter say there, these things are transmitted people to people. But does that mean physical contact, or is it transmitted in the air?
Well, they're trying to isolate that, and that's where all the current investigations are. It is definitely people to people, but whether it's airborne, and in terms of attack rate, we don't know if the attack rate is significantly above 1. If it's below 1, a virus will eventually die out. But if its attack rate is significantly above 1, then it will grow exponentially. They have not isolated specifically the attack rate because there is such underreporting from many areas. And this is also an issue in many other cities in China, that there's underreporting of these cases, and they have to isolate even more strains. So I think the numbers will climb, but the future climbing numbers may not mean that it's spreading more, it's just that we're detecting more. So we're in this sensitive wait and see. But I think the upward trajectory of this is much higher than it was in SARS. But at the same time, SARS, the big controversy was people kept it under wraps for way too long, which harmed and endangered millions. So I think this time, this early, faster reporting is good.
You know, Eric, during the SARS and the MERS outbreak as well, we heard of a phenomenon known as super spreaders. What is that, and could it happen here?
Super spreaders, I think it's those with a very high nexus of exposure. I don't think, we're still analyzing the genetics, and I think in terms of the actual exposure, children are actually considered one of the worst super spreaders because they're a nexus of so much different people converging. But right now, I think with isolation and with the screening that we have in airports, the current super spreaders, we're not sure because we are just so early. And right now, the Imperial College London estimates 4,000, 5,000 cases. We think it's going to be definitely higher, to probably 10,000 cases.
Kathryn, in the early 2000s, of course, we had the SARS outbreak. That outbreak did lead to improvements in the public health systems around the world. What were the lessons learned from that?
Well, we're seeing those lessons every day with this new virus because China learned about how to track, how to isolate, how to quarantine, how to communicate. So a lot of our guesses right now about preventive measures, for example, are based on assuming that because this is a coronavirus like SARS, that those same preventive measures will be helpful. So we're making best guesses still. This is a very new virus. We've only known about it for a few weeks, meaning it was never detected in a human before. It's going to take time to understand how this particular virus behaves. But in the meanwhile, the toolkit for public health prevention is so much stronger now than it was 2 decades ago. We've learned from SARS, we've learned from various flu outbreaks, and we're seeing that with the prevention measures now, like helping people to make the decision not to travel.
Yeah. So what I'm hearing here is that as far as this virus is concerned, it's still pretty early days.
It is very early. We are making guesses based off of SARS, based off of mathematical models of projection.
Yeah.
We aren't even sure what the incubation period is. What we're guessing is that from the time someone is infected to the time they become ill might be 6 days, it might be 7 days. A lot of people could travel feeling perfectly fine after exposure during that window. So to just try to slow down the spread and say, until we know what that containment time would need to be, we're going to err on the side of extending this a little bit longer. We're going to assume people could be contagious a little earlier than we thought.
Right.
We'll get more data as the weeks go on.
And ultimately, we stopped smallpox, not because of just a vaccine, but because of a combination of isolation and around everyone who was infected. So the isolation is what is the ultimate power. And in public health law, as Kathryn previously mentioned, public health law supersedes many other laws. In terms of national security, it has the power to lock down against someone's personal rights in the name of public health, because this public endangerment of exposure is so great if we don't lock it down.
And under those circumstances, a country would have international obligations as well.
International guidelines for public health say that the ethics of having a broad quarantine like this are that you need to be very transparent about why it's happening, and you need to lift those regulations as soon as it's safe to do so.
Yeah. Victor, the Chinese Ministry of Foreign Affairs has been addressing the situation. The spokesman at the Ministry of Foreign Affairs talked to the media. This is what he had to say.
China will continue to maintain an open, transparent attitude, act in a responsible manner for the global health and safety, report any outbreaks, and maintain close communication with the World Health Organization, relevant countries and regions, including Hong Kong and Taiwan.
Now, Victor, China was criticized during the SARS outbreak for not being transparent or transparent enough. Has that now changed?
I think as far as the current situation is concerned, over the past several days, I have gained more confidence that the government in China at various levels, starting from the central government level, at the Hebei provincial level, and the Wuhan city level, and also involving the neighboring cities, will become more up to standard in terms of information disclosure, information updating, and the transparency. This is absolutely important. Keep in mind, Wuhan is a major, large population city, which is a traffic hub. It is very intensive in terms of aviation, high-speed railway, high-speed expressway, river transportation, you name it. And the population is close to 12 million people. And there are about 1 million people, college students, for example. And this is the worst time which this kind of health hazard can happen. In China, we are expecting 3 billion travelers during the Spring Festival period. And today in Beijing is the Lunar New Year Eve. So originally, lots of people are traveling, family gatherings, social occasions, etc. So this is the worst condition. And this really is very conducive to the spread of the coronavirus. So I think everyone is on full alert, and I hope international community can gain greater confidence that the Chinese people and the Chinese government are handling this as well as we can, and there is no effort spared to fight against virus.
Right, Dr. Chen, of course, there are all kinds of questions being asked all over the world about this virus. There has been a case which has been reported from Japan of a person having the coronavirus. Japan, of course, will be hosting the Olympic Games in a few months, the Summer Olympic Games. How big a concern is that, or do we have sufficient resources and sufficient time to get this under control before that happens?
Yeah, for me, I'm cautiously optimistic because we know that there's a natural selection process like SARS phased out gradually in 2003 as a result, and even no one noticed about that. So the natural selection process is going on for all kinds of virus. So by then also we will have much better knowledge about the disease and the way to prevent it. And given this time, China is very, very transparent in the information transmission. So that will may make this epidemic much better, and also maybe phase out at an even earlier stage. So that's something I'm more optimistic this time.
Kathryn, you know, Chen talked earlier on about the vaccine. Where are we as far as the vaccine is concerned? The National Institutes of Health here in the United States says they're working on a vaccine, but it'll be at least 3 months before trials start on that vaccine.
At least 3 months, probably much longer than that. We saw that with the Ebola outbreak, that it took about a year to get to the point where there were widespread clinical trials going on with the vaccine. The vaccine is not going to be what stops this outbreak. It's going to be public health measures like isolation and quarantine. So the technology long term is something we can look to. In the short term, it's these public health measures that we really have to trust are going to contain this quickly.
Eric, there was an interview in a Chinese magazine in which the virologist Guan Yi, he was the virologist who helped identify SARS in 2001, he said that this new coronavirus outbreak in China could be 10 times bigger than SARS.
I actually do have that lingering fear. Again, we are waiting for the data. The data that's come out so far has shown an incredible faster upward spike, but we don't know whether it's because the virus is way more virulent and has a very high attack rate coefficient, or there was just underreporting of SARS. That we don't know whether it's underreporting that makes this current virus look so much higher, or whether it really is that fast. There's rumors that right now that it's highly mutagenic. It mutates very quickly, and which means that if you develop immunity or vaccine, the virus will change very quickly. And the other thing is that you can spread it contagiously even before you're symptomatic. And I think that is also one of the critical things that makes a virus very difficult to stop. Because if someone's symptomatic, you can isolate them. Yeah. But if they're not even symptomatic and can already start spreading, you can't even isolate them to begin with. So, and hence you can't get ahead of it. And that's the small bit of evidence that's leaking out that's really worries me. But at the same time, all these quarantine measures that went down, it's already went to other countries. And it's already escaped out of Wuhan. So that's the small concern.
Just one point, you talked about mutation. If the virus mutates, does that make the vaccine useless?
Not completely. For example, if you have a flu shot and you get a different strain of flu, you still get partial protection, but it's not the full protection as you would with the fully effective targeted vaccine. Right. But again, vaccines do work, and all the misinformation that's spreading around the world around a vaccine does not help against all these pandemic and epidemic scares whenever the vaccine does come out.
We are going to see the case counts go up, and they're probably going to go up pretty dramatically over the next few weeks because we are looking so hard for cases. Okay. So mild cases that we maybe wouldn't have counted before will be counted now. What we want to pay attention to is the mortality rate. And are a lot of people dying from this, or is it that we're finding a lot of cases, but most people are getting a mild or moderate infection?
Okay, we're going to have to leave it there. Thanks to all of you for being with us. That's it for this edition of The Heat. I'm Anand Naidu in Washington, D.C. Thanks for watching.